Yes, hello, good evening. How are you? Happy Sunday to you. You are welcome to another session of Ask the Doctors. My name is Dr. Frederick Unwibohai. I'm the host of the program. And on this program, we teach, we educate, sometimes we answer questions. So today we'll be having a question and answer session for one major reason. We've had issues with power supply. So we just told ourselves this evening, let's just come online and answer some of your questions. Now, if you're watching this video and we have ended, I might not be able to respond to you because you're watching a live session that has ended. But if you are live with me, if you can hear me, I want you to tell me, I want you to tell me where you're watching me from. Okay, my sound is very good. I want you to tell me where you're watching me from. Huh? If you're watching me live on Facebook, or you're watching me on YouTube, or maybe you're watching me on TikTok, or you're watching me on LinkedIn, or maybe you're watching me on Instagram. Yes, I'm live on Instagram as well. So on all my social media platforms, I'm live tonight. Facebook, YouTube, Instagram, TikTok, and LinkedIn. How are you? Happy Sunday to you. So if you have any questions for me, feel free to drop your questions in the comment section and I will do my best to respond to you. Emmanuel Olawale, live on Facebook. How are you doing? Good evening. Ogunbamowo Olami. Good evening. Happy Sunday. Kuku Temitope from Ogun State. Gasimu. Good evening. Watching from Sierra Leone. How is Sierra Leone now? How you day? I'm watching from Cameroon. How is Cameroon? Yes. How is Cameroon? I can see. I have some people watching me also on Instagram. So I'm live on Instagram as well. Yeah. I can see you. What is the cause of menopause? Menopause is a normal phenomenon. It is a stage in which a woman attains in her life where she no longer sees her period. A phase in a woman's life where she no longer ovulates. So the chances of getting pregnant is very slim. Do you understand? Menopause is not a disease, it's a normal state. Um, yes, if you can hear me, I want you to share the live session. Share and tell me your questions. Let me see if I can respond to you. Hey, Juliet Richard, happy Sunday. Happy Sunday. I'm watching on Instagram. Yes, Tona0001. I see you on Instagram. I have some people watching me also on Instagram. Yes. Oh, yeah, now let's go. Juliet Richard is on YouTube. My people on YouTube, how are you? I am following you from Bedford, England. Oh, that's nice. What's your name? Mohammed. Watching you from Lagos State, Nigeria. Oh, nice one. Okay, this person is asking me what is the best drug for H. pylori and gastritis. Peter, you will go to the hospital and see your doctor. Mr. Peter, you will go to the hospital, you will see your doctor. Your doctor will prescribe medicine for you if you have gastritis, if you have H. pylori. And I will not treat H. pylori and gastritis online. Who be this? This person says, Unweze Sonny says, I treated malaria last, and now, and I'm now having malaria symptoms. So, Mr. Sonny, who treated you for malaria? Listen, listen. If you dey listen to me very well, I dey always advise you, I dey beg you, say it is abnormal. It is abnormal for you to dey treat malaria every time. E no dey okay. So if you treat malaria before and you are feeling malaria symptom, it's important you speak with your doctor so that your doctor go find out if now something else they do you. Because some people, they go they treat malaria, not knowing that na another thing they give them problem for there. Do you understand? So I have a comment on Instagram. The comment says, by the way, I'm streaming on all my social media platforms tonight. And so I'm live on Facebook, I'm on YouTube, I'm on Instagram, I'm on TikTok, I'm live also on LinkedIn. So wherever you're streaming from, you can watch me. Somebody on Instagram says, is it normal for sperm to come out of a woman's V after releasing? Yes, it's normal. What will be your name? Okay, it is normal. Oh. People go tell you, say, if a man pour inside woman, say everything must go inside. My brother, is a lie. It's not true. As a man, when you pour inside a woman, wetin you dey pour inside? One na liquid, another one na cell. The cell na im be the one wey dey alive. The liquid na im be the thing wey the cell, those sperm cells need to take enter, survive. So when you release inside the woman, you go release liquid, semen, and the cell. When you pour inside, the cell, they go swim quick quick, they don't travel, enter inside up. Those liquid wey dey inside, majority of them go pour out. You don't need them again. But I don't hear people go tell you, say, if you pour inside woman and it come out, you get sickness. My brother, it is false. Look at me, look at my face. I say it is what is a big lie. I'm talking to you as a medical professional, and I'm talking to you as a man. So in any area where you feel take listen to me, I'm talking to you as a medical professional, and I'm also talking to you as a guy man. When you pour inside, some go definitely come out. It no mean say you get sickness or your woman get sickness. Watching you from United States of Asaba. Oh shit. Ifama, how are you now? How are you doing? Let's see. So I've answered your question, Mr. God's protection. I've answered you. Okay. Let me somebody says after cesarean section, what is the minimum time to wait to conceive? And the minimum time is about 2 years. About 2 years. About 2 years. So if you can hear me, I want you to share. Share. I want you to share. I want you to share the live session. Watching you from China, a third year medical student. Shamsuddin Abdullahi, how are you? How is China? What is the time over there in China? I think you are the second person. Are you the second or the third? Yeah, that I've had join my live stream from China. So, what is the time currently in China? Joy, watching from Ekboma. Yeah. That is now from there I finished from Ambrose Ali University, Ekboma. Yes. Okay, let's see. Happy Sunday to you, Gloria. Okay, Gloria, how are you? I see. You can share the live session. So there's this question here. It says, please, doctor, does every child come with different placenta or placenta does not change? Theodora Tamuno Tonye. So I want to try to see if I understand your question. Are you asking me that if a woman is pregnant, the placenta for this baby, when she's pregnant again, is it the same placenta? Is that what you are asking me? So the answer is no. Every pregnancy comes with its own placenta. When a woman is pregnant, as the baby they grow, placenta go connect the baby to the mother. When the woman give birth, when she born the pikin, that placenta they go come out and placenta go come out. If the placenta not come out, na big problem. I mean, very big problem. So the placenta will also come out. When the woman get pregnant again, when she's pregnant for the second baby, another placenta will form. That placenta is for this new baby to connect to the mother. When she gives birth to that baby, the placenta too will come out. When she's pregnant again for the third time, another placenta go do it in, go form. Is that okay? Yes. Now, if you're watching me on Instagram, I want to be sure that you are listening to me. If you did Instagram, let me know. Good evening, watching from Abuja. Mystery, watching from Canada. Juliet, Algo David. Good evening. How are you? Um, how are you? Let's see. Somebody is asking me a question on TikTok. So let me take one question on TikTok. Everybody watching me on Instagram, on Facebook, on YouTube, on LinkedIn, on TikTok, like this video and share this video quickly. Like and do what and share. So, what can cause frequent urination? Plenty reasons now, my guy. There are many reasons why somebody can have frequent urination. That is the person they piss well, too much. Number one, it can be normal, especially if you dey drink water plenty. So if you take a large amount of water, you go also urinate plenty. Number two, if you get problem with your metabolic process, if you get problem with electrolytes, if you get problem with your bladder, if you get problem with infection, if you get stone, many reasons why somebody fit dey urinate frequently. If a woman carry belle, the woman too fit dey urinate frequently. If a man don dey enter 50 years, the man too fit dey urinate frequently because of the prostate. So e get many reasons wey go make somebody, plenty reasons, dey urinate frequently. Okay. Please, how long does sperm last in a woman's body? Gasimu Dauda, according to research, sperm can last in a woman's body up to 5 days. That is, if you knack, you can't release inside that woman. And that thing wey you release, e fit survive inside woman body for up to 5 days. If all the conditions dey okay, if everything dey okay, the sperm fit survive. If e just dey there dey wait, even if the woman never release egg, the sperm fit dey wait 1 day, 2 days, 3 days. If the woman release egg on the fourth day, the woman fit carry belle. So according to research, sperm can survive up to 5 days. Is that okay? Oh yeah, everybody share the live session. Share the live session. No time, no time, no time, no time, no time. Ezine, I see you. Watching from China, I see you. Is it possible to be pregnant and pregnancy test reads negative? Well. It's possible. Number one, if you go do the test too early. Number two, if your pregnancy test strip don't expire. Number three, maybe you go add certain chemicals, you know, do am well. It's possible. It's possible. So if you get belle, if you're pregnant and you're finding it difficult to confirm if really you are pregnant or not, all I would advise you to do is just go to the hospital. They will take your blood sample and carry out a test on you. And then, if the pregnancy has gotten up to 8 weeks, they can also do a scan on you. Okay, it's 3:08 a.m. in China. This is 8, 9, 10, 11, 12, 1, 2, 3. So 7 hours ahead of us. Wow, interesting. So yeah, it's possible. Please, doctor, I was watching your live video about fibroid and I hang out. Please, can I get the video? What's your name? Stella. The video is on the page. A lot of people don't know how to follow a content creator. So if you dey follow me, and you want to watch any of my video, click on the username, click on my page, the name, click on the name. It go open the page. Scroll down, just dey scroll down, you go see the video. So the video is on the page on Facebook, it's on YouTube. But after 1 month, Facebook go delete am. But the video will be on YouTube forever. Do you understand? So the video is there. Many people still dey watch am, even up till now. So Stella, you can watch the video. You understand? I have a question on Instagram. You said 2 years after CS, but my doctor neighbor, His wife gave birth through CS last year, January, but his wife put to birth the second child last week. I wanted to ask him, but I say, make I mind my business. Okay. So the thing is this: any woman will give birth with CS, we advise her, we advise her to at least wait for 2 years for many reasons. But that does not mean that if the woman get belle before that 2 years, we go flog am or we go tell am say na no be normal pikin. You sure you get the point? It is advised. It's advisable to give your body time. But in some cases, some people they born before that time. It is not healthy. But yes, it dey happen. Is that okay? Hmm? Okay, let me take one question on TikTok and then I will go back to Facebook and YouTube. Can I do urinary test to know what's the main cause? No, see your doctor. You can't do urinary test. You will waste the tests. You will waste your test results, my guy. You can't do urinary test because you go just waste time. You don't even know what to test. That is why we go always beg you, say, if you get any medical problem, speak with your doctor first. But you know what? People know they hear. After you don't waste money, you don't turn, don't go test. Confusion won't wound you. Your eye don't turn, you don't know where you dey again. At that time, you come dey come hospital. That time, you don't spend money well. That time, hospital go tell you may you pay again for another test. So it is advisable for you to do wetin. Speak with your doctor first. After sex, can person drink water? Did anybody say that you should not drink water after knacking? If you make well, and you are thirsty, drink water now. There is nowhere that it is written that after sex you should not drink water. Abeg o, wetin be your name? Oduton Juwon. Oduton Juwon, abeg. Um, I don't know where you get that thing from. Yes. Okay. Um, Please, what is the best drug or cream to get rid of stubborn warts around my private parts? See your doctor now. Make them check your warts first. No, they ask for drug or cream. May we know wetin dey go on for your system first. This whole complaint of drug and cream to treat. What if wetin dey do you pass warts? What if na something else dey also disturb you? My guy. So see doctor, make doctor check you. If you are watching me on Instagram, just signify. Oh yeah, share this live session. Share this live session quickly. Share the live session. Oh yeah, share. Um, People know they share, but you can ask me question. Share, you know go share, but you go dey ask me up and down. Oh yeah, share. Quickly. Good day, sir. Please, I can't sleep well. Wetin be your name? AGK. You can't sleep well. Why? Since when? Wetin you dey do? Which work you dey do? Dr. Israel is in the house, so I'm going to bring up Dr. Israel very soon. AGK, wetin dey do you? Which work you dey do? Since when you know dey sleep well? Um, how long? Is there anything you are going through wey dey affect you, wey dey make you no fit sleep? Many things dey wey we need to find out first. We'll come tell you say, okay, Mr. Man, maybe na your job, na the kind of work wey you dey do. Oh, Mr. Man, na the medicine wey you dey take. Oh, Mr. Man, na the energy drinks wey you dey take, na im dey cause this problem. So all these things we need to find out first. Which kind of work you dey do? Since when? You don't take medicine? Because some people go tell you, say, doctor, I cannot sleep. They don't drink medicine. Now the medicine is not working again for them to sleep. So there are many things we need to know. How your lifestyle be. Many things. These are things we need to know first. wey go fit take help us advise you properly. But generally, make I just advise you. Number one, if you dey do shift work, if you are a shift worker, shift work fit affect you. Dr. Israel, good evening. How you dey?
Good evening, I did fine, and happy Sunday.
Yeah, happy Sunday to you. Nice to have you. Welcome. So, AGK, if you no dey sleep well and you dey do shift work can just be one of the reason why you no dey sleep well because it can affect your sleep. If you dey take all those caffeine, if it affect you. If you dey take medicine wey go help you sleep, your body fit don dey used to am. So these are things we need to find out. If you are depressed, some people fit get depression and dem no fit sleep. So many things dey wey fit affect person, wey fit make the person no sleep. So these are the things we need to look out for. Then we will come advise you. And that is why it go good. May you also speak with your doctor. May your doctor fit check you and tell you what to do. Okay, Maureen, I see you. Maureen, how are you? Stella, yes, I see you from Port Harcourt. Ivie Gloria, Ivie, I greet you. Dr. Israel, you get this question where I want to put. It says, is it good to have intercourse through the back?
Okay, sorry, say I did laugh, but the question really make me laugh. Well, I don't know. It depends on the individual. If now that one you like, you do one. And then after all, we say there are different type of sex. We have the anal sex, vaginal sex, oral sex. So there was no one that we can write come and say is bad. The only thing is that sometimes they tell us say some disease states can be more prone to some particular one than others. Then I don't think anybody don't ever talk about any style. Say this particular style when you they use, it not good. Yeah, it not depend on the individual. If you they use the style, they cause you pain, you stop it. And whatever the style they do for you, now you go to know whether it's good for you or not. So if you use it and it's painful, stop it. If it's not painful and you enjoy it, okay, continue. There's no it's all now. If you now married people, all now so far it make you become pregnant and you born pikin and you enjoy what you have done. So I don't think we should whether it bad is an individual something.
Yeah, thank you so much, Dr. Israel. We have a lot of questions here. He says, good evening, sir. I watch you on Facebook and you talk about hepatitis B. I want to know if I have hepatitis B and I'm using Vaseline, and I have intercourse with someone that didn't have hepatitis B without using protection, can the person still contract hepatitis? Dr. Israel, want to respond?
Is it you using Vaseline? What kind of Vaseline? I don't understand. Is it Vaseline or vaccine that you wanted to talk about? So let's be sure of what that using what? What is that? Is it using vaccine? That because now that one I go make us know the kind of answer when we go give. Yeah, that particular word there will make us know the kind of answer when we go give. So for now, I don't think I'll be able to answer that question properly until
Yeah.
you give us what you mean with that word.
Okay, thank you. If you just a comment, if you're watching me for the first time, you're welcome. This program holds every Sunday by 8 p.m. to 9 p.m. Nigerian time. This program has been going on every Sunday for the past 5 years. Every Sunday for the past 5 years. So we didn't just start today. We are live on Facebook, we are live on YouTube, we are live on TikTok, we are live on Instagram, we are live on LinkedIn, on 5 platforms. On this program, we teach, we educate, we don't treat online. Please, I know say a lot of people get many problems. You dey find treatment. You need to speak with your doctor privately because many things dey where they do people for body. So you know if you just come online say this thing they do me, which medicine make I take? No, we need to understand. So we no go fit treat you on social media. You go need to speak with your doctor. I know they do private chats. I know they give anybody my number. I'm not ready to chat with anybody privately. We are not here for that. There are some people, the reason why they're on the internet not to chat with you, that they find patients. We are not here for that. We are not desperate for patients. We are just here to teach you, give you information, evidence-based information, information that you can confirm anywhere in the world and will disappear. So we know they here so that may you can't they chat us. No, we don't get time for that. Just to teach you, advise you, and then we disappear. Is that okay? Thank you for your understanding. My baby is 6, and each time she has fever, she will lose so much blood. I want to know the cause. Dr. Israel, abeg, if you respond.
Okay. If your baby is sick and you think he's losing blood, you need to see a pediatrician. Also, you also need to know what will be the genotype of your pikin. Eh?
Hmm.
What will be your pikin genotype? I don't know because that will help us. So you need to see a pediatrician. It may just be check the genotype. It may just be that there's something that is really going on with his hematology profile. That is his blood profile that is causing such a big problem. Hmm? So please, the best thing is for you to quickly not be the one when you first go buy some medication for pharmacy or drug. After you don't do all those and finish before when the sickness don't take, you can't rush go hospital because some people does that. So please take your child to the hospital immediately you notice that the first a body they hot, so that if there's anything, and it will be nice you see a pediatrician that is go to teaching hospital or general hospital so that they go fit do series of tests, series of tests, not be just to treat am, but to really know the root cause why it is get that shortage of blood on time.
Yeah, thank you. Let's see if I can take one question from TikTok. Let me see if I can take question on TikTok. Good evening, Dr. Fredo. Please, I'm having too much bleeding due to fibroid that was removed. Um, how do you mean, abeg? You mean after they remove your fibroid, you they bleed heavily, or which one? Because by the way, they follow us. If a woman get fibroid, one symptom wey she fit get, one symptom that she might have is heavy menstrual bleeding. So if dem remove the fibroid, that heavy menstrual bleeding supposed to reduce or even stop. But if you dey bleed heavily, much bleeding, even after they don comot the fibroid, abeg o, you go need to go back make dem check you quickly o, because something is not okay. Shey you understand? But you no suppose to dey bleed after they don comot the fibroid like that, much bleeding. If na just recently dem do the surgery, you fit still dey see small small bleeding, because na operation. After a while, e go stop. But if they don do the surgery, don tey small, and you still dey bleed like that heavily, abeg o, you go see your gynecologist quick quick, make dem check you. Yeah. Can a breastfeeding mother of 4 months treat malaria?
Yes, even a breastfeeding mother of a day can treat malaria. So it doesn't have any issue. Yeah, the normal malaria medication does not have any issue with whether you are breastfeeding or not. So if you are having any symptom of malaria, please treat yourself. And treat yourself so that you'll be able to do your breastfeeding very well, and your baby will also be healthy.
Says do you also study at home or abroad? If yes, will like you to share information regarding MCN. So I study at home. I didn't study abroad. We studied at home, huh? Yeah, in Nigeria, but you're in China. If you want to get more information like that, towards like your 50th year, you can be active on X, Twitter, formerly Twitter, Shamsuddin. There are many doctors that can share their experiences with you. Doctors that are schooled abroad. I didn't school abroad. I schooled at home. So my experience here will be different from you that schooled abroad. But if you want to get more knowledge, more insights, I think you should be very active on X. Huh? Yeah. Please, doctor, can 30 years person carry prostates and cause? Dr. Israel, abeg respond, abeg.
Okay, we all have prostate. All men will not be woman and man, all men get prostate. Eh? So this prostate can have issues based on an individual. Mm? So however, we said when a man don dey grow old from 40 upward, you need to start to dey check a prostate. However, if you get somebody for your family wey be say e get problem, you get problem for a prostate like cancer of the prostate and all that, eh, for your family, e simply mean say before 40 sef you suppose don dey check, because anything can happen. And another thing is, not be only cancer or hyperplasia dey happen for prostate. Other things fit happen. The prostate can be infected. Eh? Prostatitis can happen. So the prostate can be infected, can be inflamed, it can be injured. Yeah. So people can have different injury to the prostate. So if you have different injury to the prostate, you need to treat it. And those ones not concern the age. You can be 30 years and have prostatitis. You can be 30 years and have injury to the prostate. So when you have any problem with the prostate, go to the hospital, let them check. It may not be the cancerous one. But now when you not gonna do any better treatment, any better thing, something else fit come happen. So when you notice, say, oh, if they tell you, say yes, so let's say your prostate, they do scan for you, then notice say your prostate they enlarge, then they can't do one thing, they can't see one, let them continue what they are doing, because that's the best treatment that can be given to you. But not be you go you by yourself because you don't go read for book, can't see a lot of symptoms. You can't think say na prostate, na dey worry you. Fit not just be prostate. Fit not be say your prostate dey infected or have problem. Fit be say na something else.
Yeah, thank you, Dr. Israel. Before I give my own something, let's see. Um, please, my heart has been beating for more than 3 months now. 3 months now, cause sometimes it doesn't allow me to sleep well.
John Jacob. Now, there are so many things. When your heart dey beat, one thing can just be that you need to check your heart itself. It can also be anxiety, because some people when they start having anxiety, their heart will start beating too much. So is it that you're anxious of something wey no dey there, or something that is there? So these are things where you need to first of all know. So somebody when they get palpitation and hear the beat palpitation like that all the time, e go dey hear am pum 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 pum, that e come dey disturb am. E go need to see go hospital so that they go check the heart. If na the heart na get problem, eh, they go check other organs wey dey close to the heart, eh, to know whether all other organs they do very well. And then there may be a psychological part of it, to also be sure that it's not a psychological thing. Because if it's a psychological thing, you may be having that as well. So you have a lot of many doctors that you may likely see, because palpitation is just like a symptom or a sign to other conditions. It's just a symptom or a sign to other conditions. So you need to see your doctors in the hospital so that you can get the best.
And my greatest concern is, you say your heart they beat fast for 3 months. You know they let you sleep. Why you they wait? Is it that you want to wait until you enter 1 year? You want to wait until you enter 5 years? Why are you waiting? Why you no one go hospital make them check you to find out waiting they go on? Your heart will just they give you signs small small, and you no go take them serious. Now sign be this. Most human beings no say your body can be also talking to you, but we don't want to listen. We are looking for shortcuts. We want somebody to lie to us online. There are many reasons why your heart feel dey beat fast. Many reasons. Some people feel get heart problem from small. Some of them now some things where they do, some things where they take, many things. So now only when we check you, we feel can tell you say this is actually the problem, and this is what you need to do. But if you no go hospital, there's no way we can tell you what is happening. Huh? I beg, enter hospital. Okay, let's take this question. Doctor, a child born by a HIV mother, positive mother, how long should this child breastfeed so that he or she is not infected by the mother? You're watching us from Ghana, no problem. So Israel, please want to respond to this.
Okay. So a positive mother when you born pikin, those pikin when you born, we dey call am exposed infant. Yeah. So when the mother born, we dey give am two options for in terms of feeding. Either e breastfeed or e do formula feeding. Now, if you dey breastfeed, we say for the first 6 months na exclusive. When we say exclusive, WHO say exclusive na only breast milk. You no go add anything join am, even water. Dat na normal for everybody. So the same thing we also talk for HIV person. So if you must breastfeed for the first 6 months, it should be exclusive. You don't need to add any other thing put. And most of the time, we they say this person should breastfeed for just 1 year. After 1 year, you should stop breastfeeding. But we don't notice say some people even they breastfeed more than 1 year. But however, 1 year is the recommended year. That is, once the pikin don't be 1 year, you are supposed to stop breastfeeding. I will note, when we stop breastfeeding, 6 weeks after you stop breastfeeding, they go do test for that your pikin to be sure say that your pikin is negative. Then when your pikin don't reach 18 months, they go also do test for that your pikin to also know to make sure to say yes, this pikin not really get HIV. Now, the only way when those breast milk not go infect the pikin and when the mother is aware that is positive and is taking her medication very well. If im mama dey take her medication very well, e no go fit infect the pikin. And most when e also follow our wetin we dey call prevention of mother to child transmission (PMTCT), e follow am very well, then e no go fit transmit the virus to the pikin. So the breastfeeding, can breastfeed for 1 year. For the first 6 months exclusive, no go add anything. Then the last 6 months, e can now add whatever e want to add to it. Then by 18 after his 1 year, 6 weeks after cessation of breastfeeding, we go do test for the pikin. Then 18 months, we go also do test for the pikin to take know say this pikin dey negative. The other time we go do test but I just only mention those two because na im near the ending part of the matter.
Yeah, thank you so much, Dr. Israel. Before we continue, let me say something. So, I did make videos, a lot of videos. I've been making videos since 2020 by the grace of God. And many videos they where I don't make, and some people see the videos, they go carry and put for the page, and they go get problem with their page. Some of them their page go spoil, some of them their page go down, the page they go lose the page, some of them they go lose their monetization. So I decided that make I not let you suffer. So I have a course, especially for those people who won't start. Many of the things where I suffer in content creation. So I made a course to teach you and help you. The course is very cheap. If you dey watch me on Facebook, on YouTube, on Instagram, on LinkedIn, you can get the course. You can send an email. Send this email. My admin will give you access to the course. You go pay little money. Very cheap. Very, very cheap. It will teach you a lot of things, especially if you want just start. So that may you not make some kind very, very, very little mistake. Maybe say all your labor go just disappear. You go just the regrets. And then if you dey watch me for TikTok, and you want to get the course, the link is on my page. Click on the link. You go see one link there. Get the course. Not just carry the post on the internet because they say may you post and may you grow. You can post something and your page go just spoil. You go start again, page go still spoil. So get the course and it go help you. And when you get them, you no go regret. You go thank me for the information wey dey inside. It is not free, very cheap. Huh? So let's take this question. Good evening. Can a pregnant woman still be seeing her period every month? Dr. Israel, want to
Okay,
respond?
this question, many people, many places, many people they always ask this question, and I know say they'll say, oh, they don't see this thing. But even though it go don't happen once a while, but it's not a common thing. It's not a common thing. It can be one in 100 women. So immediately you they see blood and you get belle, you know say you get belle, you dey see blood, abeg go hospital. E may be say either you wan the pikin wan comot or something else na dey happen. It can be implantation bleeding, it can be say the pikin wan comot, it can be say na placenta previa na you get, or other form of placenta problem na the person get. Because those are the main things wey fit make a woman to dey see blood even when e get belle. So because it's not a normal thing for a woman to dey see blood when e don already get belle. So when you dey see blood like that, please go to the hospital. Go to the hospital. Let the doctor be the one to say, oh, nothing, oh, but if maybe you no know and you come dey see the blood like that, you no know, but later you come find out say you get belle, be thanking God. Just be thanking God. So, oh, the belle still stay. Because it is not really a normal thing that you should be seeing blood when you get belle. Except that implantation bleeding. Yes, implantation bleeding can happen. And that will happen at early stage of pregnancy. Early stage of pregnancy, like within the 4 weeks, 4 to 6 weeks of pregnancy, or even less. That was when that one they happen. And so most of the time, some people no go even know say that. And the blood themselves, they different from normal men's blood. And the way go come out, whatever red stuff when go come out, they different from the normal men's blood. So please, once you notice anything like that, say they abeg, go hospital. And another thing when I notice is that some people they see their menses, they can't get belle. They go to say that time when they see their menses, they were pregnant. You were never pregnant. Maybe now after you can't get belle. Some persons were not pregnant. So, but because they did not know when they taking, they go even they think say during that period they were already pregnant. So, Dr. Fred,
Yeah, thank you for this. So let me read a comment where somebody dropped for TikTok. She says, let me see. She says, let me see. It happened to me. They said it's blighted ovum. Last, what happened? Last, the pregnancy comments. So if you dey see blood and you get belle, abeg, no listen to people wey go tell you say na normal thing. It's not normal. Let them check you. Because many women don't even lose their pikin because they go dey listen to people. Leave them, na lie, na lie. They won't chop your money. Na belle o, and it's not normal to see blood. One way or the other, if it affects you. So please, don't sit down at home. Let's take this question on Facebook. Doctor, since my woman gave birth to twins and we lost them 2 years ago, since we lost them, she has not conceived, not even nightmares. What is the cause, sir? Dr. Israel, there? Okay. So I don't know what happened to Dr. Israel's network. Now, if so sorry, what be your name, Mr. Mohammed? So sorry for the loss. I don't know why wetin happen, but e go good. E don reach 2 years. Make you and your woman make the doctor check the both of you. It might just be that everything is fine. Maybe your woman, maybe your woman never come out of that phase. So all those trauma, the things which they go through, fit they affect her as well. Maybe she never even heal mentally. That healing mentally self fit affect her to even conceive. If you be saying maybe now you, or there might not just be any problem at all, but you go need somebody to check you to be sure that everything. May they even follow your wife talk to be sure that your wife is fine. You might think she's okay, but she might not just be okay. So I would advise you, may you speak to your doctor, may them check the both of you quickly. I beg. Okay, Dr. Israel, welcome back. Time. Let's see. Um, uh, oh my God. So let's see this question here. Good evening. Please, I want to ask. Somebody is telling me that sleeping with woman always will make you look older than your age. Is it true? Where una they get this kind?
well, And we know that having we know that knacking they help to even reduce stress. So sometimes we even recommend that you once you should knack when you are stressed for married people, and or you get somebody, it dey help to reduce stress, actually. Say they make you come older than your age. I no know that one. I no know that one. I don't know that one. And the only thing is that one thing you should know is that everything what you two do, no, e no dey good. That is too much of everything is bad. So too much of knacking too is bad. It go make you tired too. It go make you dey stress as well sometimes if you overdo am. So what we always advise, calm down, do it. It's not a fight. It's not this thing. But say you come make you older than your age. If I don't make all married men older than their age, but sometimes you will now be seeing that even the married men are looking younger than their age. Eh? So I don't think it's not true. It's not correct. Man, not use the word it's not true. It's not correct. Yeah.
Okay, the person we talk that thing say go make person look older than the age. You know, a lot of people they do some things where they make them look older than their age. A lot of people are going through severe forms of stress. A lot of people they know they eat healthy. Those ones feel make you look older than your age, but not be the intercourse. Do you understand? If some of them they smoke anyhow, they take alcohol, all those things will damage your skin and the rest. So not be the intercourse. Now if they ask me question for TikTok, there
And
are two
sorry,
things
all those
here.
things where you sorry, Dr. Fred, sorry. And all those things where some people they go take before they go knock, fit be the reason why they look older than their age.
Yeah, yeah. A lot of young men they take those things. You go drink things because you want to perform. You want to impress a woman. Now those things where they drink, now they make you look older, not be the intercourse. Huh? So TikTok people, I know they see your messages, and if you know they follow me, and there's a problem going on, if you know they follow, you go need to follow so that we go fit answer your questions. Uh-huh. Yes, sir, I'm talking about vaccine. If I have hepatitis B,
Okay.
having intercourse with someone that didn't have it without using condom, can the person still contact it? Okay.
Okay, see, if you have hepatitis B, you don't need the vaccine. You cannot take the vaccine again because you already have the disease. The disease, the virus. However, it is the person that is negative that needs the vaccine. And if that
Yes.
person that is negative take the vaccine, if you meet with that person without condom, the person cannot get it because he already have the vaccine. He has already taken the vaccine. So that vaccine will protect that person. So it is not the positive person that needs the vaccine. It is the negative person that needs the vaccine. So let the negative person take the vaccine. Who dey positive is already dey positive. E no get any na treatment na that person need, not be vaccine. Vaccine is to prevent. Vaccine not be to treat. Yeah. Vaccine is to prevent, not be to treat. So now who never get now they take vaccine. So when the person take vaccine, even though he meet somebody where he get the virus, he no go fit, he no go affect am.
Yeah, thank you for that. I know they see their questions on TikTok. Let me check Instagram whether we get any question. No question on Instagram. So let's go back to Facebook and YouTube. Yeah, for somebody was asking, say, I'm interested in the course. Where is that person? You are interested in the if you are interested in getting the course, yes, you are interested. The link, just send an email. My admin send an email to this email here. My admin go tell you the account details. You go pay. You go give you the course. Go and learn. Oh, no go they post anyhow. Oh. You go they collect people content they post. You they post anyhow. You know set up your page right. You can lose your page. Do you understand? It's not all about monetization. You need to know what to do before you even think of making money on social media. If not, your page will spoil. Depression go hold you. You go cry in secret. So I beg, may you no go cry had I know the last comment of a word of a so get the course. It will help you. And if it no go help you, I no go tell you. Okay. This person says, answer my question. I can't see your question. I can't see your question. What is the difference between herpes and dental dryness itching? Which kind of question be this? Huh?
Herpes now virus now. Herpes is virus. And when you say dental dryness itching, that it affects the dental, that is the your teeth, the gum and the mouth. Now why the herpes can actually affect outside the lips and all that. And you will see herpes like small small boy, small boy. You go see and go round for there. Sometimes it's not painful. It does not it's not painful, except it's infected or swell. So it will not become painful. After some time, it can go on its own, and later it will come back. When your immune system is down, it goes. It comes. When your immune system is very good, it can go on its own without you even doing any treatment. But your dental stuff, you will need to apply one or two things, or you need to treat it before you get better.
Okay. Let me see. Let me see. Let me see. Let me see. This person is not following. Sorry. They follow us on TikTok. Okay. Let's take one more question here. Let me see. Let me see. Good evening, sir. Please, I'm having chest tightening. Please, what could be the problem? I want to go for a lab test. Please guide me on the type of test I need to go for. Dr. Israel, I beg respond.
Abeg go hospital. I no sabi guide person on the kind of lab test you go for from social media. And the only thing wey I dey sabi guide person to do from social media na to advise the person to go to the hospital. Your chest is tightening you, there might be things that is causing that. So you go hospital, make your doctor ask you several questions. So when he asks those several questions, those questions go come make them know wetin dey really cause that chest to dey tight. Then they will know wetin then they will know the kind of investigation wey you go do. E may not even be blood test, so make you no go waste your money go do malaria and typhoid test, because na that one na dey reign. So it may not even be blood test. So please go to the hospital. Let your doctor guide you. Hmm? It's not on social media that you'll be guided. Because if I even tell you now, you go do the test, who you want go give me, make an interpreter for you. How you want to do the interpretation? How you want to get the medication? So that is the reason why you need to go to the hospital. Let the doctor request for it, so that when you don't do one, you go see carry the result, go give the same doctor, make an interpreter for you, and every other thing can follow.
Yeah, thank you. We are almost out of time. So now this person says, which test? Make we tell and test. You no one go hospital, you won't go lab. It is wrong for you to just carry your body. Eh? Just carry your body, they go lab. You go test nonsense. You don't know what you want test. We go tell you, see your own doctor first. Make doctor follow you talk. Make him know what they do you and the type of test where you go do. If you dey ask us question on the internet, we not be your doctor. We don't even know whether your head big and your heart don't big past your head. We don't know whether this heart wey dey do you, it don't make your belly swell up. It don't make your legs swell up. It don't make you short. Many, many things dey. That is why you go see your doctor first. Go come tell you, may you go do this test. You can't go do am, can't carry the result, go back, see your doctor. But if you go do test on top internet, as you do and finish, then give you results, you don't enter one chance. You know why? You no go fit do anything again. You go come hold the result for your hand. You go dey waka up and down. You cause confusion don set in. So see doctor first, make them help you. Juliet Richard on YouTube sent me, this is €5, right? €5 on YouTube. Juliet Richard, make I thank you specially. Thank you for the €5 where you send. God go bless you. How I wish say people they send us like this. We for don't buy land for Lekki. Hmm? So I'm grateful for the €5 that you sent. God bless you. And you know go regret them, eh? Thank you so much. Yeah. Okay, let's see. Okay. What is We are almost out of time. My question is, what can cause a man not to release sperm when having intercourse?
So if a man don't he don't do knack for a particular day, he may not release sperm after some time because that sperm need to it need to regenerate. But well, there's something we call uh, uh, azoospermia, where there's no sperm. In some cases, you may even release just the semen and no sperm inside. In some cases, we have what we call retro ejaculation. So instead of you to ejaculate come out, you the ejaculate go uh inside the body. So they enter inside the bladder instead of it to come out. So such people may not actually see sperm. Then as I earlier said, somebody will do knack a day several times. Eh? A particular one may not you may not see anything to release because as at that time you don't too knack for that period or for that day. Hmm? Dr. Fred,
Yeah, thank you, thank you. So many questions there. Okay, let's take this one from TikTok. Dr. Ejodabel, listen carefully. He says, Doctor, after taking moxifloxacin, they gave me for staph infection. The symptoms still persist. Why? Lily's Kitchen, I see you. You took moxifloxacin. They gave moxifloxacin for you for staph infection. The symptoms still persist. Why? Okay.
which staff? Is it Staphylococcus aureus? The one that everybody is always singing about. Well, most of the time, I don't know who gave you the medication. The way when you take talk and it look like saying you now you by yourself go lab. Then you can't come out for lab, can't go pharmacy. So please, I just said it. I don't know if that's how it is, but that's how it look like. So please, go hospital. If you are still feeling that symptom, go to the hospital or go. If na hospital, if you go back, go and tell them that you are still having that kind of symptoms. And some in some cases, you may not have completed your treatment. And some treatment can be for 1 week to 2 weeks safe. Eh? But some people will not go even take reach 4 days because as at the fourth day, because they not dey notice any of those symptoms, or the symptoms don't reduce well, they'll say oh, they're not free. And another thing fit be say you don't treat yourself, you can't dey free, you can't still go back. Wherever you for first collect the thing, you can't go back to that place, go collect another new one. You must always get that the symptoms will come back. So that also bring to the fault that if you are treating yourself, abeg let your partner also treat theirself, so that make everybody for dey okay, make you for not go back go collect from where you for first collect before. So these are some of those are some of the things, like one, collecting, going back to get it from where it was before. Two, you not complete your treatment, so the thing never first go, so e still dey there. And three, you were not even treating the right, maybe you were not treating the right thing. So if you're not treating the right thing, it simply means that maybe you did not go to the hospital, so go to the hospital. For every other one, so we said, you will still need to go to the hospital so that they can give you medication to go and give your partner, or invite your partner for his own investigation and treatment.
Yeah, thank you. Because of time, we're out of time. He says it was sensitive to that. So from your comments, I don't even know your name. From your comments, the best advice we will give you is let your doctor see you again. Your doctor. A lot of people go get some complaints. They will go lab go do tests, go give them this result and medication. It might just be that now something else they do you, not even staff, because staff is common everywhere. Everybody gets, you understand, they everywhere. So it might just be saying that something else they do you. So you go need to go back and see your doctor. Make them recheck you. It's not out of place for you to go back and see your doctor. Let them check you again and find out, oh, waiting really they happen to you. And then they go tell you, maybe now your hygiene, or maybe now something else they do you, or maybe not even your immune system. Eh? You understand? These are things that you need to find out. And it will help you very much. Okay, now before we round up, we are out of time. For some people here, you can join my private community. I have a private community on Telegram. If you want to join my private community on Telegram, there's a link on my page. Look for the link to subscribe and join. When you join in, you can get some interactions, questions. Go answer your questions for you. It's not for consultation. It's not a hospital. It did there. People did there. People they subscribe. They join. People have been there for 2 years. They subscribe every month to join. So if you want to join my community on Telegram, the link is on my page. Subscribe and join. But you cannot go to Telegram and be looking for us to join. The only way you can join us is through the link on my page. Dr. Israel, any final words?
Okay, final words. I want to say thank you to everybody when they follow us, everybody when they ask us question. Those who will answer, those who will not answer because of time. Um, for those who will not answer, not taken to heart. It's just that time is already against us. We start by 8 and we end by 9. Time is already against us, so we don't want stretch, stretch and pass where we say where we suppose stop. So understand with us. And for those who will answer your question, please, for those advice, try work with them, because once you work with them, you will always get the best. You will always get the best. If you never follow us, whether for Facebook, TikTok, or every other of our channel, and you dey always come to join us, please try follow us. Just try follow us. If you follow us, you'll be getting a lot of information. Uh, to the extent that some of your questions you go just see am from one or two of our videos when we don't make already. You go see am for there. And thank you, Dr. Fred. Thank you so much.
Yeah, thank you very much, Dr. Israel. Thank you. Once again, if you never get the course on content creation, go and get it. I don't want to make anybody page spoil. A lot of people their page don't they destroy every day. And if you they follow me and for whatever reason you don't get problem with your page because of my content, I'm sorry. I'm very, very sorry if you don't get problem with your page because of my videos. You go they do the wrong thing and they strike your page. Sorry. So I don't want you to suffer. I beg, go and learn content creation, understand the dynamics, understand what to post, understand what not to post, understand how to protect your page. It will help you. All this information day inside the course. Get it through the link on my page, and you will never regret. Thank you once again for joining us, and thank you, Juliet Richard. Thank you for your support. God bless you and your family, and you for joining and spending your data here. We say thank you. We'll meet here again every Sunday, 8 p.m. to 9 p.m. Like I always say, good life now waiting. Good life now sense. Take care and have a wonderful night. Bye bye.